The fight against the COVID-19 pandemic in this country is not going the way we hoped. Case numbers are spiking yet again. Yesterday, Canada crossed the 1 million mark for confirmed COVID-19 cases. A year ago, that was the number of people infected worldwide. Back in April 2020, the idea of receiving a vaccine seemed a long way off. As of today, more than 5.5 million Canadians have received at least one dose. That's 14.7% of the population. But it's the variants fueling this latest surge of infections that have medical professionals worried. And as Abigail Bimman reports, it's an extra challenge with such a low percentage of the population protected.
Here's your chocolate and your egg.
Chocolate on a chair, no direct handoff for an Easter Sunday that looks so different a second year in a row.
Families can safely drive around town, mask up, come pick up their Easter egg.
Canada hit a grim holiday weekend milestone, 1 million COVID-19 cases.
It's people for me. 1 million people is a lot of people, but more importantly, it's a rapidly increasing number in the wrong groups of people who don't have access to enough services in Canada.
Cases are climbing in several provinces spurned by variants.
Potentially the busiest they've been in 15 years.
After a drop in COVID-19 hospital admissions in BC, Dr. Gerald DeRosa is now seeing them climb.
One of the bigger concerns, I think, is with some of these variants that we are seeing younger people getting quite a bit sicker and requiring a lot of critical care support.
More younger people in hospital, in part because older Canadians are more likely to be vaccinated and protected, and because there are simply more people getting sick with variants that are more easily transmissible. One BC researcher estimates variants account for half of all new cases. Alberta says it's 35% of cases there, and it's investigating one, quote, significant outbreak.
The situation that we're living right now in terms of variants is different from the one that we had last year. These variants are much more highly transmittable, and they're more prone for you to get severe symptoms.
The ICUs never really decompressed from the second wave, unfortunately, and ICU capacity certainly remains a major issue.
Dr. Isaac Bogosh is working on the COVID ward this long weekend. He says they're getting more admissions, but across Ontario, ICUs are the real problem.
If we carry on in this trajectory, ward beds will also be a problem as well.
Dr. Bogosh says the million case marker presents an opportunity to think about how we can make things better going forward. Here in Ontario, there's a real push to vaccinate vulnerable essential workers faster and better support people who can't work from home. Abigail Bimman, Global News, Ottawa.